Have you ever looked in the mirror and thought, why is my vaginal area darker than the rest of my skin? Don't worry, you're not the only one. This is something many women and girls notice, and it's actually a very common and natural change. Today, we're going to dive into the real reasons behind it and help you understand what's going on with your body. The skin in intimate areas naturally contains melanin, the pigment that gives color to our skin, hair, and eyes. Everyone produces melanin, but the amount and distribution can be very different from person to person. Things like genetics, hormones, friction, aging, and even certain medical conditions all play a role in how dark or light the skin may appear in that region. Let's start with hormones. During puberty, the surge of hormones in the body can increase melanin production, which often causes darker skin around the vulvar area, the nipples, and even the anus. The same type of change can happen during pregnancy, when estrogen levels rise and the skin responds by producing more pigment. So if you've noticed these areas becoming darker at certain stages of life, that's completely normal and linked to natural hormonal shifts. Next, let's talk about friction and irritation. Wearing very tight clothing, skin rubbing against itself, frequent shaving, waxing, or using harsh hair removal products can all irritate the skin. When the skin is irritated, it sometimes responds with something called post-inflammatory hyperpigmentation. In simple terms, that means it produces more melanin, leaving the area darker. Even vigorous sexual activity can cause mild irritation that contributes to this change. Aging also plays a role. As we grow older, our bodies go through a number of changes. The skin naturally becomes thinner and less elastic, collagen levels drop, and the tissues are more prone to irritation from everyday activities. Over time, repeated friction and trauma can cause the skin to darken even more. Thinner skin also makes blood vessels underneath more visible, which can give the skin a darker or even bluish tone. Now, while most of these changes are completely normal, there is one condition to be aware of: acanthosis nigricans. This condition causes dark, thickened, velvety patches of skin that often appear in body folds such as the neck, armpits, or groin, and it can extend into the vulvar area. It's not a disease by itself, but it can be a sign of underlying issues like insulin resistance, type 2 diabetes, PCOS, or obesity. If you ever notice a sudden darkening that looks unusual or comes with other symptoms, it's a good idea to check in with your doctor. The good news is, in most cases, darkening of the vaginal area is normal, harmless, and simply a natural variation. But if you want to minimize color changes, there are a few simple steps you can take. Wear looser clothing to reduce friction. Keep the area moisturized. Avoid overdoing hair removal methods like shaving and waxing. Choose gentle skincare products for intimate areas. Most importantly, remember this: every body is unique. Some people naturally have lighter skin in intimate areas, and some have darker skin. Both are completely normal. Your skin tone is part of your natural body, and there is no right or wrong shade. So, if you've ever worried about why your vaginal area looks darker, know that in most cases it's simply a result of hormones, friction, aging, or natural variation. It's your body's way of responding to life's changes, and it's nothing to be ashamed of.